All right, let's dive in. We're talking about a steroid today, but probably not the kind you're thinking of. This isn't about scandals or headlines. We're looking at a drug called budesonide, and it's basically a smarter, more targeted kind of steroid. Think less shotgun, more guided missile when it comes to fighting inflammation.
Okay, let me ask you a question. Say there's a small fire in your kitchen. You wouldn't set off the sprinklers and flood the entire house, right? Of course not. You'd grab the fire extinguisher and aim it right at the flames. Well, this is pretty much the exact problem doctors had for years with older, powerful medications.
And that's exactly where our comparison comes in. The old-school steroids, they were like that shotgun. Powerful, yeah, but they just blasted everything, affecting your whole body. Budesonide, though, it's that guided missile. It's designed to lock onto the inflammation and hit only that target.
So why is this such a huge deal? Well, you've got to understand the old steroids dilemma. These drugs, corticosteroids, are amazing at stopping inflammation in its tracks. I mean, they're really, really good. But all that power came with a hefty price tag because they just went everywhere in your body.
See, when a drug is systemic, that just means it's traveling through your entire bloodstream. So while it's doing its job fighting inflammation, say, in your lungs, it's also messing with your bones, your skin, even your mood. All that collateral damage, that's where so many of those infamous long-term steroid side effects come from. This got scientists thinking. What if we could have the best of both worlds? Could we design a steroid that had all that amazing anti-inflammatory power, but somehow keep it contained to just one spot? The answer, it turns out, was yes. And that answer was budesonide. It's the local hero, built for precision.
So here's the official breakdown. Yeah, it's a synthetic corticosteroid, but the magic words here are local effects, not systemic. The whole idea behind it was, let's make a drug that works like crazy right where you need it, and then gets out of Dodge before it can cause problems anywhere else. And that's the secret sauce to why it's so much safer.
Okay, so how does this guided missile actually hit its target? To really get it, we're going to have to zoom way, way in, right down to the cellular level. Let's take a look inside the control room to see how it shuts the whole inflammation factory down. It's actually a pretty straightforward four-step mission. First, budesonide is fat-loving, which means it can just sneak right through the cell's outer wall. No problem. Once inside, it finds its specific partner, a receptor, and latches on. Then this new power duo heads straight for the cell's command center, the nucleus. And the final step? It just flips the off switch on the genes that are churning out all those inflammatory chemicals. And the result of all that? Well, it's exactly what you'd hope for. With those inflammatory signals completely shut down, things just calm down. The swelling goes down, you stop producing all that extra mucus, and the whole area becomes less irritated and sensitive. And the best part? It's all happening right at the source of the problem.
But wait, there's another part to this trick, and it's just as important. How does budesonide do its job and then just disappear? This isn't some happy accident. Its great escape is a genius part of its design. You could almost say it's built with a self-destruct sequence.
The whole secret lies in something called first-pass metabolism. Here's the deal. Almost anything you absorb from your gut has to make a trip through your liver before it gets into your main circulation. Think of the liver as a super strict security checkpoint. For a lot of drugs, this checkpoint just wears them down a little. But for budesonide, it was designed to hit this checkpoint and just get totally dismantled. And this chart, wow, it really shows you just how big a deal this is. Look at that. With a traditional oral steroid, something like 90% of the active drug makes it into your bloodstream. 90%. But with oral budesonide, it drops to around 15%. That is a massive difference. Almost all of it is knocked out by the liver right away. It's a total game changer. So yeah, that deactivation chamber metaphor is perfect. The liver basically says, nope, you're not getting past me. There's a specific enzyme in there that just tears budesonide apart, turning it into useless junk. So the missile hits its target, does its job, and then the cleanup crew, the liver, makes sure the debris doesn't cause any other problems.
Okay, so this whole targeted thing is brilliant, but it only works if you can actually get the drug to the target, right? That's why budesonide isn't just one product. It's more like a whole toolkit, with different tools designed for different jobs inside the body.
And you can see that right here. If the problem is asthma, you inhale it as a mist, and bam, it's right there in your lungs. Got bad allergies? There's a nasal spray for that, hitting the sinuses directly. For something like Crohn's disease, they made this incredible controlled-release pill that only opens up once it gets to the exact spot in your gut that needs it. And for ulcerative colitis, there are foams and enemas to apply it right to the source. Seriously, each one of these is its own little marvel of engineering.
All right, let's talk safety. Even a precision weapon has rules of engagement, and budesonide is no different. It is way safer than the old stuff, but it's still a serious medication. So paying attention to how to use it correctly is absolutely critical.
And this is the big one. If you remember nothing else about asthma and this drug, remember this. Inhaled budesonide is not a rescue inhaler. I'll say it again. It is not a rescue inhaler. It's a controller. It's meant to be used every day to prevent attacks. It will not stop an asthma attack that's already happening. For that, you need a completely different, fast-acting inhaler.
No, because it works locally, it makes sense that the most common side effects are also local. If you're inhaling it, you might get a sore throat or a fungal infection in your mouth called thrush. But there's a super easy and really important way to prevent that. Just rinse your mouth out with water and spit after every single use. Seriously, do it every time. With the other forms, you might get a little nasal irritation or an upset stomach, but it's usually minor.
So what about those whole body risks we were worried about? Well, they're not completely gone, but they are dramatically lower. The only time they really become a concern is with really high doses or if you're on it for a very, very long time. In those cases, a tiny bit can get into your system and could potentially lead to things like weaker bones or a higher risk of infection. And that's exactly why doctors always aim to use the lowest possible dose that gets the job done.
And one last thing, drug interactions. Remember that cleanup crew in the liver, that enzyme? Well, some other medications can basically throw a wrench in its gears. Things like certain antibiotics or antifungals can block that enzyme from working. If that happens, budesonide can start to build up in your system, and that's when you start seeing a higher risk of those systemic side effects. This is exactly why it's so important that your doctor and pharmacist know every single thing you're taking.
You know, this quote really hits the nail on the head. Budesonide wasn't just another pill. It was a whole new way of thinking. Its entire design, all that power right where you need it, with almost no effect everywhere else, made it a cornerstone for managing these tough, chronic inflammatory diseases that people deal with for their entire lives.
So that leaves us with a pretty exciting final thought, right? Budesonide was a huge step forward in making medicine more precise. But that was decades ago. It just makes you wonder, what's next? If we could do that then, imagine what's coming down the pipeline now. As we get even smarter about designing these ultra-targeted drugs, what kind of amazing treatments are we going to see in the next 10 or 20 years? It's pretty exciting to think about.